This hormone imbalance, known as hypothyroidism, affects 10 to 20% of people. Hypothyroidism, what is it? An autoimmune disease is mostly invariably the source of this condition, which is characterized by reduced thyroid function. Almost every system in your body is controlled and regulated by your thyroid. When your thyroid is low, your entire body slows down, including your heart rate, brain function, metabolism, energy, and so forth. Even minor changes in thyroid function can cause significant symptoms that you will experience on a daily basis. You may believe that this is not a problem because your doctor can test for it. However, you couldn't be more mistaken. Thyroid patients are neglected because most doctors concentrate on other hormone disorders, such as diabetes. Fortunately, based just on your symptoms, you can frequently determine whether you have this hormone imbalance. Let's start with the first and most common symptom of hypothyroidism, which is weight gain. Additionally, most doctors focus on ordering the wrong tests, so even if they do check your thyroid, you're very likely to be told that it's normal when it's not. Unexpected weight gain is frequently the first indication that your thyroid is malfunctioning. If you have been gaining weight due to a lack of exercise or eating a lot of unhealthy food, this is not an unexplained weight gain. However, if you haven't changed your lifestyle and you notice that the scale is gradually rising, that is a serious issue with your thyroid. Patients with hypothyroidism typically gain 10 to 15 pounds of unexplained weight gain, but not always equally distributed throughout your body. To be clear, low thyroid conditions can also result in abnormal weight gain in areas like your arms, belly, thighs, and even your butt. This weight gain happens because your thyroid regulates and controls your metabolism. If it declines, your metabolism will also decline, causing you to gain weight without altering your lifestyle. Next, you should examine the condition of your skin, hair, and nails. Problems with your hair, skin, and nails can reveal a lot about a person's health and are sometimes the first indication that anything is amiss inside your body. However, if you notice that your hair is falling out after a shower or when you comb your hair, you can also look at the hair on your head. Hypothyroidism causes a diffuse hair loss that occurs across the entire area of your head, which is known as telogen effluvium. If you are experiencing hair loss on the lateral 1/3 of your eyebrows, that is a very sensitive sign that your problem is related to your thyroid because there are very few things that cause hair loss in this particular area. This is a common indication of hypothyroidism and could indicate that your hair is having trouble moving from the resting phase to the growing phase. Finally, you should consider the general health of your skin. When your thyroid is low, you will have dry or cracked skin throughout your body, but you may also notice that you are not perspiring as much or that the overall quality and texture of your skin has changed for the worse. While your skin and nails are helpful, the next symptom, cold hands or cold feet, may even be more helpful. If you wear socks to bed, especially during the summer, you probably have a thyroid condition. In fact, I call this symptom the positive sock sign. The same is true if you wear sweaters or other layers all the time. As thyroid function deteriorates, your body's ability to produce heat is slowed down, which results in cold hands and feet. But more significantly, you develop an intolerance to the cold sensation. If getting cold makes you angry or irritable, that's exactly what I'm referring to. The second area to check is the base of your neck, which is number 4 anatomically. Your thyroid lies at the base of your neck, which is right here. This is both good and terrible. Similar to eyebrow hair loss, thyroid issues are highly particular to this area. Good because it makes it easier to spot lumps and swelling in the thyroid gland, and bad because of its location in the neck, which can lead to various issues for surrounding structures if it swells. Hypothyroidism patients may occasionally, but not always, have swelling in the thyroid gland itself. The most common cause of this swelling is Hashimoto's thyroiditis, and because of the enlargement, your thyroid gland may press against your vocal cords, changing your voice. For this reason, low thyroid levels can make you sound hoarse. This is a symptom that you will likely notice immediately If you are a singer or someone who uses their voice for work, but for others, it may go completely unnoticed or not be that big of a deal. However, what is important is what your thyroid does to your brain. And number 5, hypothyroidism can cause mood swings and fogginess. Remember how I mentioned earlier that when your thyroid slows down, your entire body slows down, including your brain and cognition. Patients who have hypothyroidism frequently observe that their brain is simply slower than usual. They can't remember words or phrases as well as they used to. They can't think clearly for extended periods of time, and they even have difficulty concentrating. This is because hypothyroidism affects not only brain function, but also mood, and there is a direct link between hypothyroidism and anxiety and depression. Muscle aches and pains are number 6 on the list, and if you feel like you're not quite yourself, or if someone else has noticed a change in your personality, it might be related to your thyroid. This one is a little different from the others, so let me explain. When your thyroid is low, your muscles lose their ability to relax, which results in painful trigger points in your belly. If you start poking around after I just said that, and you find an exquisitely tender point that's a trigger point, you found it. Although it's vital to remember that trigger points aren't necessarily linked to thyroid issues, if you find that you have a lot of them along with many of the other symptoms we've already covered, there's a good chance that the two are connected. Constipation is another major sign if you have a thyroid issue. Your bowel movements are the simplest way to determine whether your gut is healthy. You don't have to physically see them, but you should be conscious of how often they occur if you don't have at least one stress-free, easy bowel movement every day. Train, you're having trouble. Peristalsis, the rhythmic movement of your bowels, is controlled by your thyroid. When thyroid function declines, your gut slows down, which can lead to constipation and the emergence of other digestive issues, such overgrowth syndromes. If you have 3 or more of the symptoms we just covered, you should tally them up to be certain that they are related to your thyroid, because many of the symptoms we've covered thus far overlap with other medical issues discussed. You most certainly have a thyroid issue. However, if you only have 1 or 2 of the symptoms we've covered, you should get lab work done to confirm that you have a thyroid issue. You'll want to know if you have hypothyroidism, and if so, watch this video to find out how to treat it. It's possible that you are simply detecting your thyroid issue early on, or that you have another medical condition. In conclusion, while a definitive diagnosis of hypothyroidism typically requires lab tests, there are several common signs and symptoms you can watch out for to help you spot potential thyroid imbalances early. From unexplained fatigue and weight gain to dry skin and mood swings, these symptoms can serve as important red flags. Keep in mind, the sooner you recognize the signs, the quicker you can take action to improve your health, whether that's through lifestyle changes, natural remedies, or consulting with a healthcare professional. Hypothyroidism can sometimes be tricky to diagnose, as its symptoms often overlap with other health conditions. That's why paying attention to your body's signals is crucial. If you notice any of these warning signs, don't hesitate to speak with your doctor, who can guide you toward the appropriate tests and treatments. Always remember, your health is in your hands, and staying informed is the first step toward taking control of your well-being. If you found this video helpful, please like, share, and subscribe to Health Angel Solutions for more informative content on health and wellness. By subscribing, you'll stay updated with the latest videos on managing and preventing common health issues, along with natural ways to support your body. We're here to help you live a healthier, happier life, and we're excited to be part of your wellness journey. Thank you for watching, and we look forward to seeing you in our next video.